Good evening. Formally, I'm Michael McMahon, District Attorney, proud and honored to serve the people of Staten Island as their District Attorney. And I too want to speak to the great disparity that we see coming down the pike with the allocation of the opioid settlement money. Before I read my formal statement, but Dr. Katz, you realize, and nothing personal, I know you're a great public servant and a great medical professional, but as you outlined, all the things that HHC is doing, it went broadly across the city of New York, all the programs running out of hospitals and all the services are delivered. And when you came to Staten Island, you talked about the wonderful staff at one nursing home and a good staff at one clinic where we do not receive all the services. So I would love to hear one day a strategy about how New York City Health and Hospitals is going to rectify the situation that Staten Island is so woefully underserved by all the programs that you run, in particular out of your hospitals, that since we don't have a brick and mortar hospital, we don't get. So someday, or perhaps Chairman Pagan, someday someone is going to start a meeting on Staten Island by saying, listen, we get the issue and we're going to do something about it, instead of saying, well, things are great, because it's not great here. And because of the historically poor and unfair treatment we receive from H&H, it's not personal, don't get me wrong. We come before you tonight with disappointment, disillusionment, and dispiritedness. While we are unique among the 5 boroughs with the smallest population, we are also unique in that we are the only borough without a hospital run by New York City H&H. We're glad to have the Gotham Clinic, but it's really so little, a drop in the bucket. And this reality manifests itself on a daily basis. As we know, our 2 private hospitals, Rumsey in particular on the North Shore and SIUH Northwell, provide the services that should be provided by a city hospital. And for a community that's larger than Miami, Florida, Raleigh, North Carolina, we're constantly overwhelmed in our hospitals because we don't have the help from you all. Quite simply, again, not personal, you do almost nothing for the people of Staten Island. And now let's talk about the opioid settlement funds. Mayor Adams himself has stated that Staten Island is ground zero of the drug epidemic. And believe me, the men and women in my office know it, working together with the police department and our great providers here and our partners. They started with the abundance of prescription pills that flooded our community, similar to other communities across the country. And the spike in overdoses hit Staten Island first, and now it's spread across the rest of the city, don't get me wrong. And we have, as you know, how it all happened. And once the I-STOP legislation got enacted, people shifted to heroin. And now with the advent of fentanyl, overdoses are spiking up. We'll probably have 3,000 deaths in New York City this year alone. But again, our proportionate share of that is very high. And so as we sit here tonight, we are intensely frustrated that Staten Island is once again the forgotten borough. And I've not heard anything that makes me feel differently. The fact that the initial $150 million due to New York City from the opioid settlement fund will be distributed without a single penny specifically set aside for Staten Island is simply unconscionable. And believe me, there are providers, professionals, and law enforcement people here would know what to do with the money. And making matters worse, the reason given is that we are excluded, is that we are not home to a public hospital run by New York City H&H. And the tragic twist of irony is emblematic of the city's narrow-minded, top-down approach to solving our biggest problems, none more urgent than the drug crisis that is claiming more lives than ever before. Just an example of our sort of the ingenuity that we have here and the self-startedness that we have. We started the whole program, many of the people in this room are here, where we offer diversion to people who fall into the criminal justice system. We built it all out on our own without any help from HHC or HHH, excuse me. And we've made a tangible difference. And yet we find now that for our good work, and up until 2019, had reduced overdoses by 20%, yet somehow, as we see the spike, last year 150 Staten Islanders died of overdoses, that we know for sure of an overdose. Now we see that once again, we are left out in the cold. If we were losing 2 or 3 Staten Islanders a week to any other cause, the response would be swift and serious. Yet here we stand on the precipice of a historic investment into our city's response to a drug crisis that has lowered life expectancy in the United States for the first time in recorded history, and Staten Island is left on the outside looking in. Bluntly, Staten Island deserves its fair share, and we will not rest until we are rightfully included and receiving what we deserve from the settlement. Right, everybody? Come on. The palpable anger that so many families still feel toward the manufacture of these drugs is real. It's a slap in the face to exclude them who were directly affected by the reasons for the settlement. It is unconscionable that Staten Islanders do not get any relief. And by any metric, whether our percentage of the city's population or more suitably the percentage of overdoses in New York City suffered by Staten Islanders, our law enforcement and treatment community should be on tap to receive millions of dollars in the months to come. So until that day comes, Staten Island will do what it always has done, band together like we always do and look out for ourselves. We did it with the whole program. We did it with NYPD, with the Overdose Response Initiative. Our great partners at Community Health Action, Camelot, YMCA, the PPS, TISA, all work so hard to do it on our own. Someday, in my lifetime, someone from H&H will come and say, let's address the unfairness that Staten Island has suffered under when it comes to the allocation of health resources in the city of New York. And this discussion about the opioid settlement money, which so affected the people of Staten Island, is a good place to start. We hope you'll reconsider that. Thank you for your time.
Thank you for your comments.